cannot be achieved through medicine. It has to be achieved through lifestyle.
Livestock should be part of the farming experience to get those microbes back into the soil.
The biggest chronic diseases that has been on the rise is cancer.
We are not genetically modified organisms. We're not designed that way, and yet we are taking these things in.
It's so important that our kids have healthy foods and be taught healthy choices.
We've got to lower our overall sugar intake, and high fructose corn syrup is definitely the big one.
But back to America, I think we have to take a very close look at the quality of our food. And I know this has been talked about before, but one of the things that I'm interested most in, if Trump gets elected and if RFK takes the helm on helping people get healthy again, I think that's going to be one of the key areas that he really focuses in on first. Is kind of like getting like bringing healthy foods, making it more mainstream, making it more affordable. I know he's very keen on kind of bringing healthy food back to school. So kind of going back to the starting point. So let's start with making our kids healthy, and helping them eat healthy. And it starts with foods in the schools, right?
Yeah.
And I know I'm kind of jumping around, but it's so important that our kids have healthy foods and be taught healthy choices. And it's just that the foods that we have available to us today are just overall not healthy. I think the biggest one is, and we've talked about this, is the high fructose content.
Oh, absolutely.
And I know that resonates with you, Brendan, a lot.
Yeah. Yeah. And I think in general, speaking like to the American public, I think they're pretty well educated on this subject in terms of like, all right, we got to lower our overall sugar intake, and high fructose corn syrup is definitely the big one, right? So they end up changing the names of high fructose corn syrup and some of these sugars to get around and the educated population, and that's one of the things I see that on ingredient labels, and it really drives me crazy. But going back to your previous conversation about, teaching kids the proper way to eat when they're in school. Well, they teach them, the food pyramid. The food pyramid has changed over the last 40 years. It's completely different, right? Actually, so I don't know if I'm sure you were going to discuss this, but there's a graph that I came across in doing a little bit of research on this subject, and it shows the consumption difference from 1970 to now. And basically what we have been being told or educated by the Department of Education and other parts of our healthcare system is that we should be consuming more grains, like oatmeal is good and so forth. So grains are like, all of a sudden they popped. So in the 1970s, we weren't really consuming much of them. They popped. And that we do know that fats are important. That is a relatively recent occurrence that we're back on the fat bandwagon, but it's different. It's not seed oils. We're not talking about seed oils. But when you look at the graph, I bet you anything that popped, because you'll see the graph goes way up from 1970 to now in terms of consumption of fat, but it's all the wrong fat. Mm-hmm. So I don't know what your thoughts are on that, but.
I agree. I think just the quality of the food, and trans fat is, as we know, not healthy at all. And just the way food is formulated today, is way different than when you and I grew up, right?
Yes.
In the amount of choices, like I grew up we had like all of our meals at home, like when like going to McDonald's was like a super luxury. Like maybe like I got a Happy Meal once a month, right? Maybe.
Right. Well, it's a super luxury now too, because a Happy Meal is like $20. So
That's true. It's
roll out the
they're
wallet.
pricing themselves out of the market. But
yeah, absolutely.
But I'd say, like fast forward to today, I feel like we're eating out all the time. Right.
Yeah.
And so we are getting foods that are amazing tasting, highly refined. They are processed they are engineered to
Yes.
taste great and create an addictive capacity to them.
Yes.
Whereas like, and I'm not dogging my mom or anything. Mom, if you're watching this, I'm not dogging you, but the food growing up, right, was wholesome. It tasted good, but I
Yep.
wouldn't say it was like addictive, right? Like I
Right.
wasn't craving mom's leftovers, you know,
Right.
3 days in a row.
You weren't getting the dopamine rush the second or third day you were
I
sitting in
wasn't
the
getting the
fridge.
dopamine rush, right?
Yeah.
Um,
Yep.
and I just remember growing up, like we didn't have access to sweets. Like we
Yeah.
had cookies. Occasionally we had ice cream, but it just wasn't as readily available to me.
Yeah.
And I just remember like not being able to eat all the time as a kid, right? So like you got home from school and dinner was like at 6:30, 7 o'clock, and then you didn't eat again. Like
Yeah. Right.
you went to bed at 9, and like many times I was like hungry,
Yeah.
but that's it. Like
But you went
you
to
might
bed
eat
at
again in
9,
the morning.
and I followed basically the same timeline. But I think that we ended up going to bed early and not being in the kitchen all the time because we were outside playing. And so like these kids
Mm,
have a much more sedentary lifestyle. They're in front of their computers doing, their games or whatever and the online games and that stuff. So it kind of like gives way, unfortunately, to a lot of these cravings, right? You're sitting in front of a screen and you're like, all right, I'll end up eating. Whereas if we were out in the ball field, you don't have access to the fridge. You're not bringing that with you. So there's some behavioral things going on there too, I
yeah.
think. But you're
So
right.
let me ask you: do you think that the average American mom or dad, we'll just say moms because they're the primary caregiver, do you
Mhm.
think they know what healthy foods are?
Um, I think that I think there's a certain social strata, right, that are getting extremely well educated, and I see them online, right? So there are some folks out there that, I mean, I've been studying this for like 20 plus years. There are some women out there that, quite honestly, give me a lesson on some of the stuff. So you have the super educated folks. Quite honestly, they're typically of a different social strata. I think the people who are, you know, working two or three jobs and eking out a living and just getting by, they may even understand some of this stuff but can't afford the food. So like, I think that's
Mm,
hopefully what RFK Jr. is going to address. um, you know Dovetailing back to RFK Jr. for a second, he spent a good part of his time going after large producers. Like he wants small farms to come back. He wants small American
yes.
farms as opposed to these monolithic commercial farms that we now have, that are, quite honestly, they're endangering our food supply as well, right? So you have companies like Smithfield, who, and you follow RFK Jr., and I haven't taken a deep dive into uh, some of the assertions that he has made. So he basically says that they got involved in the legislative process, made it very difficult for small farms to exist, and then Smithfield essentially brokered contracts, ate them all up, became this monolith, right? And then they sold to China. So now China is in charge of basically like 80% of hogs, pork in this country. That's a major food danger, right?
Mm,
But on top of the fact, to your point, they're not treating those hogs right anyway. So we're not necessarily getting the best of the best. But
mm,
I think that he sees that piece of it, and and I did a little bit of research and found out that one of his campaign advisors is Charles Eisenstein. And if you don't know anything about that guy, which I didn't,
mm,
he's big into sustainable farming. So
mm.
he doesn't want to see these pesticides being used as much. He wants small farms to come back and rotate crops. He believes livestock should be part of the farming experience to get those microbes back into the soil, to have less soil erosion through runoff and so forth. So, like, these are very interesting ideas that obviously are part of what RFK is conceptualizing in terms of, a better overall health for America. It'll be interesting to see if he gets in, but I don't know what your thoughts on that are.
Did you hear him talk about his interest in building what is called wellness centers? Have you picked up
Yes.
on that? Okay,
Yes.
so I'll just kind of try to recap. I
Yep.
guess he got exposed to like a wellness center over in Italy that was designed. The whole premise of this wellness center was to basically take people that were kind of down and out,
Yeah.
addicted to drugs, or just struggling in life. And there was also like people that had, done their time in prison and basically kind of rehabilitating them. But the way he was rehabilitating these people was through these wellness clinics where they
Wow.
get exposed to organic farming. They get trained up on certain traits like how to raise animals,
Hmm.
and other traits. But basically, it's about getting back to the basics
Yeah.
and eating right and exercising and then learning a trade. And all
Yep.
this whole program that was in Italy was 100% sponsored, I'm assuming by the government, because it was free to the people that were accepted in the program. Well, in one of his interviews, RFK Jr. was talking about creating these wellness centers or something like that in the country here, in rural areas throughout the country. And I think
Yeah.
that's a great concept. I would
Yeah.
love to. I want to replicate that throughout America, not just
Yeah.
to people. Certainly people in need, but I think everyone could benefit from a wellness center.
Totally. Yeah. And I thought one of the interesting things, I don't know if you came across this, was they banned cell phones. So like
Yes,
just like
yes,
EMFs, like they've thought about every little little piece of this thing, and they're like, let's just basically it's almost like let's go back to the Amish. Like whatever they're doing out there in Pennsylvania, let's try and replicate that thing because they're healthy, and I've
yeah.
taken studies and looked at those things too. It's just like I think he's on the right path with this. It's very interesting.
One of the biggest chronic diseases that has been on the rise is cancer.
Yes.
And I wanted to get your thoughts on why you think we're seeing an increase in cancer over the last decade. Do you feel that's related to like the food, the quality of the food? Do you feel that's related to like cell phone exposure? Um, where do you think, or is it deeper than that?
Yeah. That's a great question, and I don't know if I can necessarily answer it. Nor do I think that I am probably the person to answer this. However, my own thoughts on it are, I think it's if you start taking a look at the pesticides and herbicides that they're using, right? And we'll talk about this because RFK Jr. has gone after Monsanto on this too. So we'll get into some of the details on that. But I think it's a combination of the pesticides and herbicides that are a lot more prevalent in the environment. I think genetically modified foods. If you are what you eat, we are not genetically modified organisms. We're not designed that way. And yet we are taking these things in. We don't actually completely understand what the long term effects of these things are. Can these things be part of our DNA? Can they be spliced in somehow? Are they negatively affecting our microbes? And are the microbes preventing some critical absorption that would prevent some of these diseases or negatively impacting our immune system? I would say yes. And there's good scientific proof to show that. Are EMFs having a negative effect? Yes. Is a lot more, we rely a lot more on electricity than we have before. Everything is an EMF nowadays. You pass down the street, you're going to pick up about 90 wireless routers if you're in the city. you know, I think all of these things are contributing factors. And then you have to throw into the mix the stress. I think social stress is
Yeah.
is way out of control. And
Yes.
there's a lot of reasons for that. And there's a lot of them are financial. I think we've been duped into having two parents leave the household, and they end up both being, breadwinners. But as a result, it's a supply and demand thing. So it's not like you've gained, it's not like you've doubled the income of the household. And the statistics show this. It's that what you've doubled is the supply of labor. So companies have dropped their costs as a result. So, and that obviously puts a lot more financial stress on the household. So I think there's a lot of things going on there, but definitely food. I mean, if food be thy medicine, medicine be thy food. If that's the case, and we have absolutely destroyed our food in this country, then that has got to be top on the list.
Well, I couldn't agree more. I think just kind of circling back to where we started, which is the obesity epidemic in
Mm-hmm.
America. I think if RFK Jr. were to get into office, I really want to see an emphasis on solving that problem. And to me,
Yeah.
solving that problem is through education.
Mm-hmm.
So you have to educate people on what to eat and what not to eat.
Yeah.
You have to give them access to healthy foods that are organic in nature, but not off the chart expensive.
Yeah. Right.
So education and affordability, those go to hand in hand. And then the third one is we have to bring people back to exercise on some fundamental level. Like
Yeah.
I'm too sedentary. I'll just be honest. Like I need to get
And
out and
myself too.
exercise more.
I'll throw
I
myself
need
in
to
the
be
mix too.
yeah, I need to be walking more. And I think
Yeah.
about this, like this is important to me. But uh, I think if we can get the American people exercising again, and that doesn't mean like going to a gym and lifting weights. If that's what it is for you, that's awesome. I
Yeah.
encourage that. But I feel like just walking, just get out and walk 20 minutes a day
Yeah.
can make a world of difference, a huge difference.
Yeah, and I remember, I can't remember, was it back in the 80s or the early 90s? I remember the White House ended up pulling in Arnold Schwarzenegger to get the country going again
Yeah,
and get them back
yeah.
into exercise and all that stuff. But we've completely gotten away from that. That's not something that we even discuss anymore, unfortunately, because politics has become so, like such a bitter pill. I don't know why they don't go that direction, but I think where was I going to go with this? The other part of this is, um, are you,
Well, I'm gonna just jump in real quick because I
go ahead.
wanted to make sure like that I wasn't like my facts were straight. I wanted to make sure before I said this, but I talked to my daughter last night and I said, because she's in high school now and she's a senior, and I said, like, do you guys have like PE, like gym class,
Yeah,
like
right.
what is it like now in high school? Because when I was in high school, we had that every day. Like you had to go against like you had to be dodgeball or kickball, right? And
Yep.
and all that. But I was like, do you guys have that now? And they don't really have that. Like
Mm,
it's like once a week
yeah.
versus like what we used to have, which was like every single day for about 30 minutes. So
Yeah.
for high schoolers, it's once a week. It's kind of like even though they go and they walk around the track, it's kind of optional. It's not like
Yeah.
structured like it used to be when you
Right.
and I were in high school.
I remember I remember specifically when I was in middle school, they required us to run a mile. And if you didn't run it under, I think it was 9 minutes. I mean,
Oh yeah.
9 minute mile is, if you're running a 9 minute mile, I mean, I had some kids in my class who were running under 6. Okay. So I couldn't keep up with them, but I wasn't that far behind. But if you didn't run the 9 minute mile, you were going to do it again. And so these were part of the requirements. Same thing with like chin ups and sit ups and all that stuff. I doubt very much. I mean, who knows? School systems might get sued by parents if they tried to, institute these kinds of policies again. But that's what was going on when we were kids. You're right.
Um, so yeah, I just kind of thought about that as it relates to what's actually happening to our kids, and I think these are just fundamental changes that have to be made.
Yeah.
They're not glorious, they're not sexy,
Right.
but if you want to like solve this obesity epidemic, if you want to reduce the number of chronic diseases we have, it cannot be achieved through medicine. It has to be achieved through lifestyle.